In Chicago, Black people are the most likely to die from COVID-19, accounting for more than 40% of deaths there. But one major hospital that predominantly serves Black and lower-income communities is on the verge of shutting down in the middle of this pandemic. NBC News correspondent Antonia Hylton spoke with community members who are fighting to keep it open.
Etta Davis is angry. She's boarding a school bus in the middle of a pandemic, on her way to protest the looming closure of Mercy, the hospital she depends on.
Mercy! Mercy!
We're tired of hearing that there's no money when it comes to us.
You'd be hard-pressed to find a Black person in Chicago who hasn't been hurt by COVID. Black residents have been the group most likely to die of the virus since it began. So the closure of Mercy, a historic hospital dedicated to serving the poor on the South Side, represents another heartbreak.
In this community alone, we have, as I say, over 216 seniors. Then we have a lot of people that are in wheelchairs, walking around with canes, and they can't afford to take Ubers.
What message do you think this closure sends to Black and brown neighborhoods here in the city?
I don't know what it's telling them, but it's telling me that you might as well just roll over and die. We don't care about your health.
Mercy Hospital has long had financial woes, and the pandemic hasn't helped. Its owners, Trinity Health, say it's not profitable enough and could close as soon as February. Patients like Davis, who has a heart condition and diabetes, will immediately flow into other hospitals like Provident, which has had its budget shrink too and downsized its ER. Dennis Kosuth was a nurse there, laid off just last week.
Is Provident ready to handle a new influx of patients when Mercy closes?
Absolutely not. There's no way that they're going to be able to handle that. And this is in the middle of a pandemic.
What's your greatest fear?
People get brought to Provident. They can't breathe because of asthma or because of heart failure. They need life-saving measures immediately. And my greatest fear is that someone will be brought there needing those things and not be able to access it. And it doesn't have to be like that.
We spoke with Mercy Hospital President Carol Schneider, who expects this site to turn into an urgent care center.
We're in the middle of an unprecedented pandemic. Is there not something that can be done to either reverse this decision or to delay it for a couple years?
We really want to take into consideration some work we're doing to place all of our programs, place our patients, and place our staff in other healthcare facilities in the Chicago area. And we'll take the COVID surge into consideration when we set a final date.
While she's holding out hope that a new owner buys and restores Mercy, Etta Davis is already asking her doctors to gather up her medical records as she tries to stay healthy.
Do you think this is the last time you're going to fight a hospital closure in a Black community in Chicago?
Oh, no. I'm in it to win it. I'll be out here, bundled up, marching again and again and again.
For more on the impact of Mercy Hospital's looming closure, MSNBC correspondent Trymaine Lee joins me now. He's also the host of the Into America podcast, along with NBC News correspondent Antonia Hylton, who's outside Provident Hospital in Chicago. Antonia, Provident Hospital is likely to take in many of the patients from Mercy once it shuts down, but it's also strained. What concerns are you hearing as they're getting ready for an influx of patients?
That's exactly right, Allison. People here are pretty panicked about that prospect. You know, as you heard right there from Dennis Kosuth, who was a nurse here at Provident, he was just laid off along with a couple other nurses. They've downgraded their ER. But I think one really critical piece of information about Provident is they no longer offer maternal and birthing services here. So if you're a Black woman on the south side of Chicago and you were hoping to have your baby next year in Mercy Hospital, and now you're going to be a patient at Provident, you're not going to be able to do that. And Black people desperately need maternal care here in Chicago. There are major disparities in maternal and infant care and mortality rates here. And so just that alone, I think, represents the kind of pressures that are going to end up being on the system as patients come here and find that even Provident isn't able to take full care of them now.
Trymaine, the closure of Mercy Hospital adds to already existing healthcare disparities on Chicago's South Side. As one local op-ed put it, the South Side was already, quote, living in a healthcare desert and a place of economic distress. Tell us more about that.
Yeah, the South Side community is really weathered a lot. It's what you can consider a disinvested in community, like so many other poor black and brown communities across the country, but also in Chicago, like the West Side, where since 2018, they've already had 3 hospitals shutter. Mercy would be the 4th. But it's not just the healthcare institutions. In recent years, they've closed 50 public schools, mostly in black and brown communities. And if you were to take one of those transparent slides of a food desert and then lay over top of it an education desert, and then now on top of that, a healthcare desert. And then you add to that, these are the same communities weathering an uptick in gun violence and also historically police violence and abuse. This community is weathering so much, but again, not much different than other communities like this across the country. And so the loss of Mercy, the impending loss of Mercy, is just yet another blow to a community already weathering so many other storms in different fashions.
Antonia, the CEO of Mercy Hospital told you they'll take the COVID surge into account when they set a final closing date. What are city and state leaders saying about those protesters' demands to keep this hospital open?
Yeah, so in addition to telling me that they're taking this COVID surge into account, the CEO, Carol Schneider, made clear to me, though, that she's pretty sure this is a done deal. She doesn't think that there's really a chance of turning this around. And she says this is likely going to turn into an urgent care center. To give you a sense of the kind of downsizing that will be seen at Mercy's location. But protesters and community members are putting pressure right now on city and state leaders to try to find a new buyer who would purchase Mercy from Trinity Health, the owners of Mercy, and they would hope commit to Mercy's original mission, which was to provide health care to poor people of color on the south side of Chicago, and to make that, especially the piece about caring for people who are poor and uninsured, really a key part of its mission. But that's been increasingly hard for hospitals, not just in Chicago, but around the country to do, given the way that health care is delivered and the fact that people who depend on Medicaid and Medicare, their reimbursements are often a lot lower. And it's hard for these institutions to thrive. But that is what they're fighting for right now. And right now, while city leaders say they've taken meetings and talked to potential buyers, there really has been no clarity, no commitment. And many of the protesters, some of whom were right behind me earlier today, they feel like, frankly, they have not been listened to.
I love that one woman saying, though, she is in it to win it, not giving up. Trymaine, in the latest episode of your podcast, Into America, you spoke with a doctor from Chicago about how we can address the racial disparities in our healthcare system. What did he have to say?
I spoke to Dr. Thomas Britt, who has been practicing on the south side of Chicago since the 1970s. And what he describes is kind of a pre-existing condition, right? We know that pre-existing conditions make you more likely to catch COVID-19 and also die from COVID-19. And being black and poor in this country is also a pre-existing condition. So Dr. Thomas Britt stepped back and gave us kind of the 30,000-foot view of all the structural inequality and systemic racism that guides so many black people from the cradle to the grave. But he said it kind of takes a big picture view and vision, because in some ways all the systems are complicit in this. But let's take a listen to what Dr. Britt had to say.
There is blame all the way around. The question is, do you acknowledge that you contribute to this, and what can you do to make it better? And then, so if you acknowledge it and you're a politician, if you acknowledge it and you're a corporate entity, and you acknowledge that you're the physician who didn't give this black patient cardiac catheterization, if you acknowledge all these things, are you willing to make a change? And the change is not going to come overnight. We didn't get into this mess overnight. We won't get out of it overnight. But we have to start, and we should start tomorrow.
In so many ways, the Mercy Hospital situation is just a symptom of a much broader issue. And while it's great for folks to acknowledge it, people on the ground who will suffer most when that hospital goes away, they need action and real action. But it may be bigger than just what's happening in that hospital. It's much broader across the city, across the state, and in this entire country. But those folks on the front lines are pushing and hoping for something better, something that will make their lives a little bit easier. Allison?
This is such an important story. Trymaine and Antonia, it was awesome having the two of you here together to bring it to our viewers. Really appreciate it.
Thanks, Allison.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here, and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.